Hey, what's going on, everyone? Dr. Beau here, and this is your hashtag Ask Dr. Beau show. I am excited to be here with you today for two reasons. The first reason, it is June 20th, and that is mine and my wife's anniversary. So, honey, if you're watching this, happy 8th year anniversary to you. Can't believe it has been 8 years, 2 kids, a house, 2 dogs, a whole bunch of fish in between. Anyway, happy anniversary to you. For all of you guys that are also here, today I answer your guys' questions. Today's question actually comes from a patient of mine. Her name is Michelle, and she wants to know more about scoliosis in kids. Her question is this: Hey, Dr. Beau, I have a 13-year-old daughter, very active, and they were doing end-of-year physicals with the school nurse. She's about to enter high school, and she has been told, that she might have a case of scoliosis. What are your thoughts on scoliosis? What do I do? What should I do? They told me to go to her pediatrician, but I thought I wanted to ask you first. So, Michelle, let's dive in. Let's talk a little bit about kids and scoliosis. I've actually seen a lot of this come through my practice in the past couple of months. So let's talk about it. Let's have a conversation. If you guys have questions about kids and scoliosis, feel free to definitely type in the box below. I will do my best to answer while we have a few minutes here together. So the first thing that every parent should know about scoliosis is this: scoliosis is non-life threatening. People hear the term scoliosis and they automatically freak out. They're going, what's going on? What is this big term? First off, there's a whole wide range when it comes to scoliosis. So I'm going to walk you down the path, let you kind of know what's going on with your daughter here, Michelle, and then give you the opportunity to take the right steps to ensure that we're doing the right thing. So, as you probably know, scoliosis has to do with what they call the curvature of the spine. Anytime that there's curvature of the spine, automatically the medical community will name it scoliosis. So, there's usually a two-curve curvature of the spine because the body's always balanced, right? So there'll be an upper curve and a lower curve. Now, determining how much curvature really kind of determines where you are on the scale of scoliosis. So let's talk about the different scales of scoliosis, and then ultimately what you as a parent can do with with a child with scoliosis, and some not tos with scoliosis. So if your child just was at the end of her school year physical, typically they have them do a bunch of tests that have them bend over and touch their toes. The nurses or the physical trainers will look at them from the back, and they're looking for the curvature. They'll run their hands up and down the child's spine, and they're looking for any deviation in the curve. And what they're also looking for is, as the child bends over, they're looking over their back and they're trying to figure out if they have what they call rib humping. That is when one side of the rib cage is up higher than the other side. Usually that's some sort of indication that there's a curvature going on. And to be honest, that is about all that the nurses at the schools are trained to do at this point. And that's fine. That's all that they should be doing. They should be monitoring it and figuring out, hey, is there curvature in this child? Is there not? If it is, they want to refer it out to us as a specialist or their pediatrician. Now, most pediatricians, the first thing that they want to do is take an x-ray to confirm that there's scoliosis. Now, there's 2 reasons that they take x-rays. Number 1 is for confirmation. The second reason is that it gives us what we call a baseline of activity. That basically means that, hey, look, we took a full spine picture of your child and we see curvature. Now, they're going to measure the curvature, but what they want to do is establish a baseline. It is standard protocol for every child that has scoliosis to have an x-ray taken, and then every consequential year to have another x-ray taken. It's super important because what we do is we look at from 1 year to 1 year, or from time period to time period, and we monitor the progression of the scoliosis and the changes. And that is probably the most important factor in all of scoliosis. Scoliosis is obviously measured on the curve. I'm trying to draw it up here. So the curvature of the spine as the curve comes down in the back. Hey, Edward, thank you so much for tuning in, brother. Love all the work that you guys do over there at Honda as well. Anyway, what we're trying to do is we're trying to get a baseline of what the curvature is. Now, they measure basically the tops of one vertebrae from the bottom of the other vertebrae, and they kind of make like a diagonal type of thing, and then they measure the inside portion of that curve. Kind of like, remember back in like old school geometry days where they kind of measured all over the curvature? So that's what they're doing as well. So here's the thing, that there's kind of 3 levels of scoliosis when they're just looking at the x-rays, okay? Anything less than 20 degrees is considered one type of scoliosis, right? The second, or the moderate, is between 20 and 40 degrees of curvature. Then anything over 40 degrees of curvature is kind of what they considered a severe curve. Now, your upper curve can be very much different than your lower curve, just so you kind of know that, okay? Now, here's the thing. Most people that have curvature, it's either all the way has been done, people notice when they're 25 or 30, or it's just like your daughter, right? She's 12, 13, just starting off. So what we're trying to do, what the pediatrician, what the chiropractor is trying to do, they're trying to monitor where the baseline is of the scoliosis. Now, there are actually 2 different types of scoliosis. There is one which we call structural scoliosis, and another one which we call functional scoliosis. Let me explain the differences, and maybe this will make some more sense to you, Michelle. If you have structural scoliosis, this is a genetic predisposition. Matter of fact, Michelle, you might have scoliosis. Your grandmother might have scoliosis. Her great-grandmother, you maybe have aunts that have scoliosis as well. And that is just a genetic predisposition of things that happen. Now, the reason I say mother, grandmother, etc., is because usually it runs more on the female dominant side. Now, I have seen a few males in my practice in the past year or two that have had scoliosis, but typically it is a female dominant trait. And the reason is because this is a very estrogen-driven disease, so to speak, or estrogen-driven condition, which means that the more estrogen that's present in the body, the more degree of curvature that we see in the spine. It's also important, Michelle, that when your daughter, who's 13 right now, is monitored, because guess what? She's just about to enter puberty. And between age 13 and to 18, even up to 21, is our highest level of changes when puberty is happening, which also has the highest level of estrogen. So that's when we will see a lot of the curve changes that are happening in the body. So the first thing to do, obviously, you're going to go to your pediatrician. They're going to take an x-ray, and they're going to give us a baseline to say, hey, look, here's where your daughter is right now. Now, based upon if she is, low, moderate, or severe, that's what next will determine the outcome as far as the treatment protocols of things. So that is for a structural-based scoliosis. A functional-based scoliosis is when the body has curvature in the spine, and that's usually due to tight muscles, an injury, maybe poor posture for a certain period of time. Maybe your daughter was injured and she's been leaning to compensate for a long period of time. That can relate to having some curvature in the spine as well, and we can look into that, and that is definitely more of a chiropractic issue and less of a actual, medical, we have to do some sort of bracing type of issue as well. But here's kind of the tricky thing about it, is that a lot of times we see an overlap of the two, where we have a person that has some sort of degree of genetic or structural scoliosis, and then they have functional components because their body is trying to compensate and lean away and, poor posture, etc. So the first thing to note is this. They definitely want to get a baseline x-ray and say, hey, look, here's where we're at today, and then we're going to monitor it over the next course of months to year. Okay? Now, what other things can you do as far as a parent, and what can she do to help out with decreasing obviously the progression of the scoliosis, and what things can we do to keep her active? And to be honest with you, that is the answer. The answer is, in my opinion, a very balanced relationship between structure and function. If your daughter was younger, I have a few patients that are 6, 8, 10. I don't necessarily push them into taking an x-ray immediately unless I really think that they're into that moderate, 20 to 40 degrees of curvature. I am more focused on keeping them active. That is so incredibly important. So your daughter, I would say, should be involved in every sport that you can physically get her involved with. Make dance, basketball, baseball, hockey, soccer. I don't care what it is. I want your daughter to be super active. She should be running and jumping and moving and doing very physical activities every single day. And the reason is because those full body, full motion activities infuse her muscles with blood, and they keep them moving and grooving, so to speak, right? They keep the blood flowing in the body. What happens, what we see with a progression of really quick progressing scoliosis, is the patient is sedentary. They do nothing. Right? They may hurt, so they don't want to do anything, which means they may sit, which means they may be playing on their phone, which means they have poor posture, and the dominoes kind of knock down further and further, and that progresses the scoliosis worse. So if your daughter is in that beginner, less than 20 degrees of curvature, I so want her active. The second thing that your daughter, and this goes through all 3 degrees, is that I highly recommend chiropractic care if you have someone that has scoliosis. We are dealing with structure and function, and that is being communicated via the nervous system in the brain. And a chiropractor is the only trained professional to monitor the nervous system. We have an amazing way of doing that. Yes, we will adjust the spine to a lift response in the body, which will cause muscles to rebalance and the body to function correctly. So getting on a regular chiropractic rhythm with your daughter getting adjusted, again, super important. Most of my scoliosis patients come in to see me about every 3 or 4 weeks. Some of them vary in activity and vary in their frequency because maybe they're really active or they're training for something, or maybe they haven't been so active and they need to be seen a little bit more. But most kids that have scoliosis are seeing me once a month. They do fairly well as long as they're staying active and they're continuing to do their stretches and exercises as well at home. I also think that that's another very important component of this, is that I know a lot of kids, I'll say, hey, you need to be stretching your hip flexors, you need to be stretching your chest muscles, we have to create the balance, and if they don't do that, then they can tend to go the other way, and that progression can get worse a lot faster. So number 1, keep your daughter very active. Number 2, make sure she's getting adjusted by a chiropractor on a very frequent basis. Number 3, make sure she's doing stretches every single day. And then the number 4 thing is that, I really think it's important that your daughter is eating the right sorts of foods. And if you're into supplementation, there's some really great things out there that your daughter, you should look into. They should be taking a really good multivitamin, looking into magnesium and collagen. Bone broth is another thing that's really hot right now. But what we're seeing is that all of the extra nutrients are helping to replace a lot of the stuff that's depleted in our soils from our GMOs, from the bad foods that we're eating, and that by giving those nutrients back in, it's giving the body the best ability to heal and to function at its highest level as well. Every patient in my practice knows that I believe that they should all be taking a multivitamin. They should be on some sort of omega-3 fatty acid and some sort of probiotic. And, for a person with scoliosis, I can't, say enough about the benefits of those things as well. Now, a lot of people will ask me, Beau, what do you think about bracing a young child that has scoliosis? And my answer to you is that I really believe that the child should have to be between over 20 degrees of curvature and, 20 to 40 degrees of curvature is when I'm thinking that I'm going to be looking to some bracing, because I really feel like that's when the curve is helped the most, so to speak, is in between the 20 and 40 degrees of curvature. I can give you guys a reference to the Clear Institute. Matter of fact, I wonder if I could pull this up real quick. Let me see if I can pull up my computer real quick here, and you can see this. Let's see here. It's Clear Institute. Clear Scoliosis Institute, clear-institute.org. Sorry, that is the website that is very, very helpful for your child that may have scoliosis right now. You can read a a ton about what they're doing. It's here locally, or not locally, in California. They deal with scoliosis every single day. Over on a couple of my websites on Circle of Docs, there's a whole bunch of exercises that you can do as well. Different stretching. Pilates is great for it. Hip rolling, planks, anything that's going to build up the core. I am really, really in benefit of doing with a person with scoliosis. So I know that I got some questions here. Frankie says, went from 45 to 51 degrees of curvature in 6 months. Yeah, that is a ton of curvature. Obviously, I know you, Miss Frankie, and I know that you're a person that had to have cervical intervention. And for any person that's thinking about having cervical intervention, I highly recommend that you do all of the conservative treatments first before diving deep into the cervical intervention. There's a lot of studies now showing that maybe cervical intervention isn't the best thing for us to jump right into. So we definitely want to be very conservative in our approach as far as wanting to recommend to going and automatically having surgery. And it is a crazy invasive surgery, guys. If you've ever seen the pictures of that, super scary looking. I'll tell you what, getting adjusted by a chiropractor is nothing compared to the surgery involved with scoliosis. So I think I'll wrap it up here today. Thank you guys so much for spending the last 15 or 20 minutes with me. Michelle, I hope that, the question that you asked me about what to do with your 13-year-old daughter. Let me wrap it up real quick with you here. There's two types of scoliosis, functional and structural. We have to determine which one it is or which both of it is. We always start with a baseline x-ray at the age of 13. If they're younger, then we don't unless we see a lot of curvature. So let's start with a baseline x-ray. Let's see what her curves are looking like. If it's less than 20 degrees, then automatically we are definitely opting for a lot of activity, a lot of stretching, a lot of, getting into a chiropractic care and doing some at-home strengthening stretches, and also looking for working on your hip flexors and adding in some nutritionals. 20 to 40 degrees, all of the things I just mentioned. Also be looking to doing some bracing, and then over 40 we're going to be having some consults and seeing where we go from there. So I hope that helps answer you guys a lot of questions here. Thank you guys so much for tuning in here. Lisa Lopez, Trisha, Tabor, hey Tabor, Robin, thank you guys so much for joining me today. I hope you guys like this format. I always get asked to do a lot of it, so I think I'm going to start at least doing it once a week. If you have a question, please feel free to send me an email. You can drop me a line here, send me a direct message here on Facebook, and I will do my best to answer them. Like I said, I get a ton of them, so I try to pick out the ones that are really common and help you guys out. So have a wonderful day, and finally, again, happy anniversary, my love. I love you so much. 8 years. I can't wait for the next 80. And thank you to everyone that joined us today, and I look forward to talking to you later. Bye now.